Roughly half of all adults have high blood pressure, and many don't know it because for most people, it causes no noticeable symptoms at all, even at levels that are quietly damaging their heart, brain, and kidneys over time. That's why regular checkups and home monitoring matter so much. But there's a different, more urgent situation we need to talk about today, like a hypertensive crisis. This is when blood pressure spikes to 180 over 120 or higher. At that level, some people do experience real, noticeable symptoms. And recognizing them quickly can be the difference between a manageable situation and a medical emergency. As always, this video is for educational purposes only and isn't a substitute for medical advice. Please talk to your doctor about your specific blood pressure targets and risk factors. Sign 1, a severe headache, different from your usual kind. This isn't a mild everyday headache. It tends to be intense, sudden, and unlike anything you'd normally experience. When it shows up alongside a very high blood pressure reading, it's one of the clearest signals your body sends that something urgent is happening. Sign 2, shortness of breath. If you suddenly find yourself struggling to catch your breath, even without physical exertion, and it's paired with a high reading, this can indicate your heart is under real strain and needs immediate attention. Sign 3, chest pain. Any chest pain combined with a very high blood pressure reading should be treated as a medical emergency, not something to wait out. It can be a sign your heart or major blood vessels are being seriously affected. Sign 4, sudden vision changes. Blurred vision, difficulty focusing, or noticeable changes in your eyesight can happen when extremely high blood pressure affects the blood vessels in your eyes. If this comes on suddenly, don't dismiss it as just tired eyes. Sign 5, nosebleeds and dizziness. While an occasional nosebleed can be harmless, one that occurs alongside a very high reading or dizziness that comes on suddenly is worth paying close attention to, especially if it's unusual for you. Sign 6, confusion or symptoms of a stroke. This includes sudden facial drooping, slurred speech, or sudden weakness in an arm or leg. If you notice any of these alongside a high blood pressure reading, this is a true emergency. Treat it exactly the way you would treat a stroke, because at this point it may already be one. So, what's the actual number to watch for? According to the American Heart Association, a hypertensive crisis is a blood pressure reading of 180 over 120 or higher. If you check your blood pressure at home and see a number that high but have none of the symptoms we just covered, don't panic. Sit quietly for a few minutes and check again. If it's still that high, contact your doctor. But if that reading comes with chest pain, shortness of breath, severe headache, or any stroke like symptoms, call 911 immediately. That combination is what turns a high reading into a true emergency. Let's quickly recap the 6 signs. 1, a severe, unusual headache. 2, shortness of breath. 3, chest pain. 4, sudden vision changes. 5, nosebleeds or dizziness. And 6, confusion or stroke like symptoms. Remember, high blood pressure usually shows no symptoms at all, which is exactly why regular monitoring matters even when you feel completely fine. If this video helped you understand your blood pressure a little better, please consider subscribing. I'm creating videos just like this one every week, covering the health topics that matter most after 60. If you found this helpful, share it with someone you care about, knowing these signs could genuinely help someone one day. Take care of yourself, and I'll see you in the next video.